Merriam-Webster defines resilience as an ability to recover from or adjust easily to misfortune or change. So for our panelists, they may each have a slightly different take on what resilience is. So what better way to find out than to bring them up and introduce them? So joining us this morning, Dr. Atiya Martin, who spent 16 years in federal and local government, working in just about every possible sector: intelligence, homeland security, emergency preparedness, public health preparedness, and resilience. She's currently the CEO and founder of the social enterprise All Aces, Inc. And what they're working to do is activate the power of consciousness, critical thinking, to help manage the ways that our unconscious and mind can interfere with personal and organizational resilience. They help people have tough conversations. She's the former Chief Resilience Officer for the City of Boston and also serves as a Distinguished Senior Fellow at Northeastern University's Global Resilience Institute. Dr. David Barish is Executive Director of the GE Foundation. He leads the foundation's work in health, education, and disaster response. And as part of those efforts, he and his team work to improve surgical access for underserved populations around the globe. In terms of education, he's leading GE Foundation's commitment to improve STEM education opportunities. He's also a practicing emergency medical physician, and he and his team have been critical partners of Americares' work, most notably supporting Americares' emergency and U.S. programs. And Kate Tashino is Americares' Vice President of Emergency Programs. So she happens to oversee preparedness, response, and recovery programs, not just in the U.S., but around the world. She's never not busy, I think it's safe to say. So she's responsible too for deploying emergency response teams and coordinating these large-scale deliveries. We're talking about medicines, relief supplies, and then also implementing recovery programs to help restore health services for disaster survivors. So each one can tackle, part of this entire view that we need to look at this morning. But I would like to start with just a short description from each of you, about a minute, of how would you define resilience?
So first of all, thank you for having me. I'm very excited to be here in support of Americares. We go way back. Kate and I have been in the trenches together on several occasions. And so for me, resilience really is a combination of things. And that combination of things I refer to as a practice, right? So on one level, it's a process that we have to go through in order to understand what are the challenges we face, the threats, the potential consequences of those threats, what are our vulnerabilities, and what are our strengths. And then mapping out a course to how we're going to actually address those gaps. I think the most important part of that is this idea of what I most appreciate about resilience is it actually forces us to connect the dots between the day-to-day lives of communities and what happens when there are disasters, to your point earlier. And then the last thing I'll say is it's also a set of capabilities, right? So once you identify, go through the process, you have to build up the capabilities, and then finally outcomes, making sure that we're looking at the appropriate outcomes that show not just that we were able to cope or adapt to emergencies or disasters, but that we actually leverage them as transformational opportunities to shift how we're doing things on a day-to-day basis when there are emergencies and what happens after emergencies.
Okay, Dave.
Well, first of all, thank you as well to Americares for inviting me to be here. I think, like my colleague who spoke a minute ago, I'm an evangelist, an Americares groupie. I love doing anything I can do to support Americares, so I'm really privileged to be here. I think about resilience in a couple of ways. One is it's an emotional resilience, and there's a structural resilience. And I think on the emotional side, it's your ability to realize that not everything's going to be in your control. And when something happens that's outside of your control, how do you respond to that? What do you do? And that's at the individual level, but also at the community level. And on the structural side, it's what can you do to control the things you can control, so that when the unexpected, the crisis, the emergency happens, you're actually as prepared as you can be, and you can deal with those things that are actually out of your control. And as I said, this is both on the individual level, your individual emotional preparedness, and what are you able to do, but your individual practical preparedness. Do you have homeowners insurance? Do you have emergency funds? Do you have a place you can go when a crisis happens? Do you know how you're going to reach your family members? It's just that practical piece of controlling the things that you can control. And on the community level, it's the community having the emotional connectivity that when the unexpected happens, they can come together and do something together. New York would be a great example after 9/11, how the community came together after that incredible disaster and yet bonded together despite the day-to-day differences that people might have. But on the structural level, if you didn't have a plan, not just 9/11, but anywhere, if we don't have a plan to respond to crisis, what will we do? Who's going to do it? How's it going to be done? What is our response going to be? You'll never be resilient. So it's being able to control those things that we control as a community on a structural level. I know we're going to talk a lot more about that, but that's kind of the way I look at resilience.
Okay, so two good definitions from two good friends. So I think about resilience in very similar ways, really thinking about it as the capacity to respond quickly and be able to recover quickly from any type of difficult experience. I think about it, just as you mentioned, David, it's a mix of that physical, mental, and emotional toughness, and it's really the ability to bounce back, or as we say, I think more commonly now, the ability to bounce forward. And so, Eric, I know you mentioned Puerto Rico. I think Puerto Rico is a great opportunity to talk about resilience in action and also the absence of resilience. So when I think back, there was a health facility in Ponce that believed that something, the strength of Maria, could happen. And they had put investments into training their staff. They had invested in generators. They had even gone so far to have underground electrical grids already put in their facility. And then on the flip side, there were other facilities who didn't have the plans and didn't have that practice, and they didn't move their medicines from one place to another. And so what you saw was that first facility be able to not only continue serving their patients and keep their doors open to provide healthcare services, but to even be able to go out to other communities where those other facilities weren't open to make sure that those individuals were also taken care of. On the flip side, you saw thousands and thousands of dollars that were wasted. There were medicines and supplies that were devastated, and also those facilities lost power, and they weren't able to open their doors. Really, at the end of the day, they weren't able to serve their patients.
So which blends perfectly into our next point. So based on your experience in emergency management, when we look at resiliency and disaster preparedness, right, as we heard just the tale of the two different health centers, are they one and the same? I mean, where do you see the difference between the two?
So for me, I see the difference. So first of all, to be clear about preparedness, when we're doing preparedness work, what we're really doing is building out our capabilities so that we can do the mitigation work we need to do to reduce the impact of emergencies, to do the response work, to do the immediate aftermath response, and then the blurry line from response to recovery, and what does it mean to help a community get back up on their feet, and who's involved in those conversations. So that's what we're doing around preparedness, and it's very explicit about the emergencies and about disasters. What's different about resilience is it includes those things, but it also forces us, if we're doing it well and if we're thinking at the comprehensive level of resilience, we're actually looking at the social domains, we're looking at the economic domains, we're looking at the environmental domains, the physical infrastructure, and even governance. And we're saying to ourselves, what is happening on a day-to-day basis in a community? What's happening on the social, across all those different domains? What's happening today? Because what we know about disasters is they actually aren't presenting a whole lot of new problems. They're basically surfacing the problems that communities already have. And if we're not clear about what those problems and what those issues are across all those domains, then we're not really doing the best that we can do for our communities and in partnership with communities, and making sure that there's some foundational principles around resilience that are important at all of those levels that you mentioned earlier when you were saying that there's this individual level, there's a community level, there's an institutional level, there's a citywide level. And in acknowledging that at each of those levels there are things that people need in order to collectively have resilience. And I think a lot of times we fall back into silos, and one of the principles of resilience is kind of breaking down those silos and acknowledging we live in a complex adaptive system, i.e. mostly urban environments and even rural areas are complex systems. And what does it mean to connect the dots across these issues and think more comprehensively and holistically about issues and not just what's in front of our face in the moment?
David, what are you seeing on a global level, right? So we'll start from the top down in terms of some of these models that have become really effective.
Yeah, so that's a great question. Let me give an example of one that I think is not really related to natural disaster, but related to another type of crisis, which is pandemic. So in 2014, the Obama administration kicked something off globally called the Global Health Security Agenda. And ironically, Ebola started in 2014, but this was actually kicked off well before Ebola in February of 2014, really as a response to SARS and MERS and influenza. And the idea behind the Global Health Security Agenda is to get countries prepared for pandemic. And the model that was put together, right now at Global Health Security, I think there's about 76 countries that are members of the Global Health Security Agenda. It's led by the G7. And the model that was put together was, let's understand as a series of countries what our capabilities are relative to pandemic. Can we prevent them? Can we detect them? Can we respond to them? And a series of measures were put together to look at those three categories: prevention, detection, and response, in large part with the leadership of the CDC and WHO to help countries look at their own structure. And the way this is mapped out is they do internal evaluations, then they have neutral, what are called joint external evaluations with CDC, WHO, and other experts coming into the country to evaluate their capacity. And then they, from that evaluation, then build a plan so that they can do those three things: prevent, detect, and respond to pandemic. And now some of the countries have implementation plans. Some of them are actually in the process of implementing those plans. And some of the countries are even in the process of trying to test their plans to make sure they're effective. So it's a great example, and these collaborations are not just governments doing this, but they're looking at their own civil society, they're looking at their own private sectors to support it, obviously government, and then international multilateral organizations to help them in terms of technical assistance and financing. But it's a great model for what actually can be done in any circumstance. It's not just pandemic. You can do it for disaster response. It's the same idea. Look at what you're good at and where your gaps are, develop a plan to fill those gaps, test yourself, implement your plan, then test yourself. And that can be deployed in anything. We're actually doing parts of this now in our work. Erica mentioned our work in surgery. We're actually using parts of that in our work around surgery. How can we help countries understand their gaps in surgery, build a plan to fill those gaps, and then go fill those gaps? We're starting to use some of it in our work in the opioid crisis as well. What can we help states do to understand their gaps and fill those gaps? And as an emergency physician, we do this every day. We have a plan for crisis, whether it's an individual patient who comes in with trauma or a cardiac event or a true disaster. We have a plan that's in place. We do drills and exercises to test that plan. We reassess it, and then we build the plan again. So I think it's, that's one example of what's being done as a model globally. I think that can just as easily be used for natural disaster and other types of crises.
So that was sort of the top down and the big broad, as you pointed out. Kate, one of the things that Americares does, especially in the local health clinics, is really work in many ways, from bottom up and focusing on these local communities and helping individuals learn how to be more resilient, how to mitigate risk. What are some of the tools that Americares has in some of the programs?
So I think Americares does a great job in terms of what was talked about earlier, not only responding to the crisis, but staying there and making sure that they actually bounce forward. So the community actually not only is responding to what's in front of them, but also rebuilding their structure, power systems, health systems, so that the next time a crisis happens, number one, they've learned from the previous crisis, and number two, they've rebuilt and probably built beyond, so including a new plan, including new human resources to be able to respond to the next crisis.
And you've been a great partner in that process. So I think Americares thinks about how we strengthen resilience and mitigate risk by working through those local health centers, our health systems, and communities that we serve. So within that, we really look to focus on the safety net, those individuals and communities that are low income, that are under-resourced, that are either uninsured or underinsured, arguably those most at risk for disasters. And so as we think about that, and we know that when disaster strikes, it not only leaves a path of devastation, but what it really does is put those who are struggling the most, arguably further into poverty. And so really for us at Americares, that's that nexus between disaster and poverty that really exacerbate each other and really make us think about what it is and why we invest in this line of business to get to the best health outcomes. And so when we think about the programs that we do, we want to use our experience and our technical expertise to make things as simple as possible. So some of the principles that we operate off of are address those common challenges: coordination, communication, resource management, things that all of us in this room, I'm sure every single disaster, are faced with. We want to make sure that we're making it simple. So for a lot of folks that we work with, they're experts at providing health services. We don't expect them to be experts in preparedness or resilience. And so we work to break it down for them. We talk about what are the types of services they offer on an ongoing basis, and then say what are those essential services in times of disaster that you want to keep doing? What are the ones that you want to actually ramp up a little bit, and what are the ones that you might want to put on hold? And just boiling it down and making it very easy for them to talk about, it builds up their confidence to go out into the community and say, here's what we're planning to do, and here's what we need help with from you to be able to help us get our work done. And then we also have the principle of interaction. And so when everybody comes to our workshops, they not only leave with better understanding of what it means, but a lot of times they walk out with a plan, something that's actionable that they can put to use right away. And so when we think about our work, I think so much, and what you said, Atia, so much of preparedness and resilience is about being empathetic. And so understanding off the bat, what is it that people are going to do in times of disaster, really? And then being able to build those systems around them. And so in the Philippines, where we've been doing work for a while, every time we start to build a new relationship with a partner, we listen to say, where are you in the process? And while we have a structured program, we need to retain that flexibility to be able to meet them where they are. We also need to be able to hear them. And so being a good listener is a big part of the work that we do on an everyday basis with all of our 4,000 partners around the globe. And so when we listen, a lot of times we hear, that's great, and we need that. But we also need, in the Philippines example, was to know how to use a fire extinguisher. We have them in our building, but we don't know how to use them. And so we hear those things, and we're able to flex our training to include things like that. And then we also hear sometimes to say, oh no, only doctors and nurses need to come to preparedness training. And we actually push back on that and say, no, preparedness is everybody's responsibility. Everybody in the facility should know what to do. Mm-hmm. And so there actually was a time, a couple months after a training that we did, where it was the janitor doing his normal rounds within the health facility, smelled smoke, and actually caught an electrical fire that was starting. He used the fire extinguisher and put it out. And so while there was some damage within that facility, in the closet, it didn't burn the facility down. And so just like we were saying earlier about the visions of preparedness that we want to capture, and we don't want the headline news to just talk about the facilities that burn and the death and destruction. So I think that was a really good example that we're proud of.
Erica, can I add a comment? One of the things that Americares does so well is they understand that it's not just the urgent issues that have to be taken care of, but even in the setting of a crisis, of a flood, of a hurricane, of an earthquake, whatever it is, that there are babies that are still being born, that there's chronic disease that still needs to be managed, that there's mental health that still needs to be addressed. And Americares has done a great job in understanding it's not just the urgent, but the entire system that we need to be mindful of.
I know in some of your research too, Atia, you've looked at social inclusion and the vulnerabilities that can drive certain communities and often leave them more ill-prepared for disaster. So all of these great things can be going on, even at the local level, and yet getting to the people who need that information, meeting them where they are, you have to have that conversation about social inclusion, and you have to talk about the differences, whether it's race, whether it's gender. How do you bring all that together?
So I think first is important to go back to a point that Kate made. You led with arguably, like, those are the people who are the most vulnerable. The research shows that it's not arguable, right? Like the people who need the most support after disaster, the same folks who are struggling every day to just live, right? And we've made some policy choices in every society, so this is an international phenomenon, that have excluded some people and included others and put some groups over other people. And in the United States, one of our biggest challenges is around race and racism. And so when we look at the data and you look at who are the groups who are disproportionately burdened by the impacts of disasters, it doesn't mean that everyone doesn't suffer. It means there's a disproportionate burden on people of color, on people who are low to no income, on people who have disabilities, people who have chronic or acute medical issues, people who are children, older adults, especially older adults who live alone. And so when we think about the challenges that we face and what shows up when there are disasters, it's the things that are happening that where the decisions we're making day to day that are actually causing these perverse outcomes on the other end. And so I bring that up as we think about social vulnerability, as we think about resilience and social inclusion, to remind us that the reason why we have those challenges around social vulnerability and exclusion is because we made decisions collectively that led to those outcomes. And so if we're going to shift how we think about and approach working with communities, it means that we actually have to shift ourselves and how we think about who these people are that we're engaging with, right? And that it's not charity, right? That it's actually a partnership, and that folks need self-determination. That's a resilience principle, not to go into communities and tell them what they need to be doing, but to go into communities and understand what they've already been doing, and how that the work that we're trying to do in emergency management, response, disaster preparedness, resilience, that we're actually there to help support them and build around what they've already built, because every community also has resilience. It's a reason why they're still here in spite of all the challenges that they face. And so, so when we think about where there are opportunities, there's opportunities when we think about mitigation, that it's not just about stuff, right? That it's also about, well, what's happening socially? Is there a way that we can embed programs and also help build social capital? Social capital, not just in terms of individuals having relationships with each other, right? The highest level of social capital also includes that people have relationships with institutions and they know how to navigate them. Right? That's part of social capital that never gets talked about. That's important before emergencies happen and after. Because if I don't know how to navigate institutions before, I definitely am not going to be able to do it afterwards, especially when you layer on all of the social challenges that we have in our society in terms of how we've been socially conditioned to think about different people.
I do want to make sure we leave time for questions, but if I could maybe just ask each of you really quickly, maybe in one sentence, what do you think the most important driver is when it comes to community resilience and preparedness? This time we'll start with Kate.
Sure. So I think it's not cliche to say, think global, act local. And so anytime we design and implement programs, we're always mapping them back to global frameworks. And at the same time, we are always questioning ourselves to say, how is this impacting the lives of those we're serving? And then also, it needs to be realistic. One of the struggles that we consistently come up against is time. We know that these trainings are needed, and the providers also know that they're needed. But what we're looking to do is, how do we make it most efficient in terms of our delivery? And so in places like Texas and Puerto Rico, we're starting to do integrated delivery of both that training preparedness, but also what you said, David, the importance of mental health. And so integrating both of those resiliency approaches into one essential coordinated delivery.
David?
Yeah, I would say it's not only accept, but embrace the idea that the next crisis is going to happen without a doubt. And so plan for it, prepare for it, test yourselves on it, control the things that you can control when the next crisis happens. And I think that what will happen is your resiliency will be there because you're controlling what you can. It'll make it much easier to control those things or have an influence on those things that you were unable to control. So plan, understand what's going to happen, and practice, practice, practice so you're ready for it.
I will say, I'll lead with a quote that's stuck in my head right now, which is, if it's not your struggle, it's invisible to you. And in that spirit, this idea of making sure that the people who are impacted, most impacted, are at the table, and not just at the table to check a box and be tokenized, but actually a part of the decision-making process. Like I said, self-determination is one of the biggest resilience factors at an individual level, at a community level, and even within, across an entire jurisdiction. So I would say making sure that people, their humanity is respected in the process, and they're not seen as objects to be done with, for things to be done to, as opposed to people to partner with to accomplish a common goal.